Journeys is a more focused approach to working than now. A client will come in through the single point of access, at which point their care will be determined by one of the superclusters. This will be psychosis, non-psychosis or organic.
The biggest change is working in one big team rather than smaller individual teams that we have at the moment. We'll have a breadth of senior clinical knowledge across the whole team, working with the junior members of staff, a lot of shared working, a very different way of managing caseloads where we'll be able to acknowledge and identify the highest risk patients, and that's shared across the multidisciplinary team. So the risk is shared. It makes management of risky cases easier and safer.
It's obviously critical that any team, whatever shape or form it is in, needs adequate supervision and leadership at the helm of things, without which they are bound to be a lot of problems. And I think this is a perfect opportunity for us to embed clinical leadership at the root of what all we do, in order to provide supervision and support to not just our senior clinicians but also junior clinicians, so that they feel safe and confident in order to deliver their jobs in a meaningful fashion. Everyone will have a role to play in the new Journeys program, and that would involve admin support too. We as frontline clinicians need their support to keep going. We realize how stretched we can be, and without their support it would be extremely difficult to do what we do.
What's really exciting about the Journeys programme is it just doesn't look at how we use staff more creatively, it also looks at other ways of working. For example, using technology to help us in our work. This may be mobile working, conference calling, or it could be just speaking to someone in a corridor instead of waiting for a weekly meeting.
I think what the Journeys programme asks of us and offers us is an opportunity to develop our thinking about how to better coordinate the care for our clients. Historically, the responsibility for care coordination has fallen upon the shoulders of an individual. That has very often been quite an isolating experience. I think what Journeys is asking us to do is to think about how, as practitioners, that we can contribute to the coordination of care better. I've heard the analogy used of a pit crew from Formula One racing, where you get 5 or 6 guys changing 4 tyres in 4 seconds. And whilst I wouldn't want to overextend that analogy, I think it does offer us some scope for thinking about how can we better coordinate and be more efficient in how we're providing the care that we provide for our clients.
Since 2009 in Mid-Essex we've been pioneering an age-inclusive memory service, and with the introduction of Journeys that will go across the trust. So if you have a suspected memory problem or a diagnosed memory problem, you will receive the same excellent evidence-based assessment and treatment wherever you live and however old you are. Journeys is a very exciting time for us. At the moment we have a day hospital based in Chelmsford. We open 7 days a week and offer activities and support to our service users. From the introduction of Journeys, we will then be able to offer more intensive support in people's homes and in the community.
I think Journeys also offers us an opportunity to think about the importance, the centrality of dialogue in our work. It promotes the idea that we should be talking to our clients in a more inclusive way, the client networks in a more inclusive way, but we should also be working together in more inclusive ways.
I expect that open dialogue will be very popular and very well appreciated by patients and their families, because that's something that patients always ask. They want to be addressed, they want to engage in dialogue with professionals, want to be part of decision making, want to be part of thinking about the treatment and management. And that's exactly what is the central for open dialogue approach.
The reality is that mental health services receive less and less funding each year. Unfortunately, the population continues to grow and we are expected to provide the same high quality service regardless of funding. This has meant that Journeys has had to come up with more creative ways of using those resources.
We run really good services, but there's always room for improvement, and this is the way to make the improvement for our service users, for the families, their carers, and for the staff in the Trust.